This is Dr. Fergus with Cornerstone Health, and I'm sitting with Dr. J.
That's me.
Future doctors, our preceptors here, Zach Main and Jacob Przydzial, and we're just going to chat a little bit about the preceptorship opportunity here at Cornerstone, as JP and Zach are now at the end of their preceptorship. So I'll start off for a question for either of you. What has been the most valuable part of your experience here as a preceptor?
Personally, for me, the most valuable part is all the hands-on experience that I have received at Cornerstone Health. At the start of my preceptor, I was kind of thrown into patient care, which was really good. I was able to get a bunch of hands-on experience, communicate with a lot of patients, and just see different perspectives and different cases. So that really helped me become a better clinician.
I would echo kind of what JP said, but what kind of is valuable for me, I would say, is just being being surrounded by these two incredible docs. I feel like every day I came in and learned something new. They were able to simplify things that didn't seem as simple in school, and I feel like that's something that I'm going to carry with me the rest of my career. So.
Oh, that's great. Yeah, some of those things don't really click until you get a couple hundred patients under the belt and start processing through those items. So that's good. I'm glad things are clicking for you. And then, when you're going into the preceptorship option or clinic option, there's a couple avenues you can take. Not everybody does preceptorship. Some people stay in the school clinic. So when you chose to do a preceptorship, what was behind that decision for you?
For me, it was definitely the opportunity to get a bunch of hands-on experience. I know a couple students in my cohort went to a preceptor and all they did was shadow and they didn't learn a lot. I personally learned best from experience, so I wanted a location where I can get a ton of hands-on, kind of echoing what Zach said with these two amazing docs here, following the grip approach in DNS and taking a multifaceted approach to patient care, not only looking at pain, but looking at objective findings, quality of movement, looking at diet, looking at stress factors in life. So I feel like I was really looking for an opportunity in a location where I can get a lot of hands-on, but dive deeper than just subjective pain.
Great.
My answer is going to be very similar.
We'll have to ask you first next time.
Yeah. A lot of hands-on, a clinic that kind of followed the active care approach like we do here. I feel like that was a little bit more difficult on campus, and just seeing a bunch of patients in different cases and unique cases as well. So,
Awesome.
To what extent do you feel the grip approach will be applicable to your future positions with other clinics?
I think extremely, from my perspective. I feel like grip approach has really simplified things for me, and maybe I don't use it 100% like it's used here, but I feel like it gave me a good framework on how to kind of approach patient care, and it simplifies things, especially early in my career when I had a lot of questions. So I think it's very applicable for me.
I would also say that it's very applicable to me. I think it's simplified. It follows a strategic, blueprint for patient care. It's super informative and basing for quality of movement. There is kind of a downside of it with the language. That was a struggle for me, especially with some of the retro coxas and especially some of the FROM tests. But once you get the wording down, it makes it super easy, knowing that genu means knee and anti means the anterior motion of the knee, so it makes it super simple.
Okay, great. Thanks. What was surprising? What was the most surprising thing about doing your preceptorship here? Something that was completely different than what your expectations were?
For me, it was the number of unique cases. Doing my rotation at school, you would always have a patient come in, or majority of patients come in with some low back pain that they did because they were carrying a box of books or something. Here, we have a lot of different unique cases, from chronic pain to ankle fractures to low back pars fractures. So just getting a different perspective and seeing a whole lot of different cases was super unique.
Yeah, I would branch out I get this question asked quite a bit from people that don't have any experience with chiropractors that want to know what we do. Do we see people with back pain? Is that what we do? And yes, it is. But what's unique about our practice? And I think a unique thing is at Cornerstone Health, we really try to use what's available to us within the profession. So we're diagnosticians. We refer and talk to other providers. We make a diagnosis. We make a treatment plan of things that we can do and what they need to do elsewhere. So we're not trying to use that word chiropractic as just a technique that's offered at a chiropractic office, but the full application of the profession.
I also noticed with my time here that I have talked to more patients about diet and activity than I have anywhere else in my time at Logan University, educating them about the importance of eating a healthy whole food diet, staying away from processed foods, and making sure that they're getting exercise and getting their vitamins and whatnot.
Is that based on what the patient needs were here, or just an opportunity to kind of branch into those areas?
It's for both. Some patients ask questions about how they can mitigate inflammation or improve their health longevity. Other patients just find it interesting, so they'll ask questions.
Okay.
Yep.
Great.
My answer would be similar to his. I'm going to go off that, though, and go away from the clinical side. I think the business meetings that we do, the weekly team meetings, was very unique for me, something that I wasn't really expecting. But I feel like it holds a lot of value for me going forward, just to see how we approach things in a chiropractic office and how it's done kind of in the real world. And then also some of the marketing events as well. Just that's
Cool.
something that we gloss over a little bit in chiropractic school, but kind of seeing that hands-on here is something that's valuable going forward.
Well, without dropping any trade secrets, what about the business meetings, the weekly meetings? Is there like one or two takeaways from that you think were impactful for you?
I just think what goals to make and what kind of you're looking for as a chiropractic physician, and then also marketing opportunities. I feel like just kind of going over some of those as well was something that opened my mind and was unique to me, not really expecting that. So.
Oh, great. Dr. J, you have any other questions you want to pose?
Not right now.
Okay, so before I ask any more questions, I want to give you both a chance. Do you have any questions for Dr. J and I? That now I know, Zach, your last year of the preceptorship here. What's the question you've been waiting to ask, or anything of the sort?
This is cliche, but what's one piece of advice you guys would give to someone that's graduating this week or next week?
Ooh, oh man, you've come guns blazing on that one. One piece of advice. I'm not sure who said this first. I think I probably heard it as a quote from Brett Winchester. But patients don't care how much you know until they know how much you care. And I think you're both really good examples of that here, like really caring for the people in front of you. And then being super knowledgeable on the back end. Like, we're not shy about that, but that's second to actually caring for people. So that's the heart of it. But then probably the lessons for me that have been the hardest to learn, and especially anybody who might be setting up their own practice, is to try to get a good grip on accounting as early as possible. And that can be as simple as knowing what you need to charge and how many patients you need to see to pay the bills. That's the easy part of accounting. But then as you grow, things can get a little bit more complex. And starting a practice without some general accounting knowledge is really challenging. So seek some professional help if you are starting a practice. If you're joining a practice like ours, hopefully it's a practice that's taking care of their accounting. They know what goals they need to set. They're working and kind of massaging those things. So if you're a new graduate that's looking to practice in another practice, I think it's a fair question to ask. Like, what's the financial health of the practice? What's the trajectory? Where are some areas you're trying to grow? So you have a good idea of what you're stepping into.
I would add, learn soon where your strengths and weaknesses are, and use those weaknesses to build what we used to call a Rolodex, so that you can refer out so that the patients are getting the best fit, and so that the patient isn't blaming you for inadequate progress, so that you can start getting referrals to you to reciprocate that. Just learn what you want to do, what you want to specialize in, and to refer accordingly, whether it's to something outside of where you work or in-house like we do here.
You have a question?
Just a quick question. So in school, you get handed all this study material and books, and you have to, study on your own time. When you're in an office or in a clinic, you kind of learn based on the patients that you see. How do you guys handle cases that you've never seen before? Do you guys research articles? Do you read up on books? Do you ask other chiropractors or even MDs or physicians about advice? How would you guys go about that?
you want to start?
Usually I get some notice as to the gist of why a patient is coming to see me. So if I see some Latin word of a condition that I don't recognize, I could research it before the exam. Otherwise, if it's just slam right there, I will confer with my colleagues here and say, hey, have you seen this before? Do you have any tips on it? So yeah, just keep a good network of people who could support you in this kind of thing. Again, people who do things that you don't do so well.
Yeah, that's great advice. I would add, like with a lot of these wilder or more rare conditions, there's not often black and white answers to them, whether they're seeking you or a PT or a neurologist. There's going to be a lot of gray area, but there's guidelines along the way. So what we do is really powerful, right? So if we have somebody in who has stage 3 cancer, I have no expectation to do anything that's beneficial to treating cancer, but I know I can provide some pain relieving items for them. I can get them more comfortable and more active, and that can be part of their healing. So in a case, an extreme example like that, I still need to know how they move. I need to know their sleep habits, their movement habits, all the things that I need to run in my typical exam. So my strategy is to get the information I know during the history for what kind of research I need to do later, but then still run them through my grip evaluation. Understand, like in my office, what are the things that I can help them with right away, get that all taken care of the exam, and then when I sit down, I say, okay, there's a few parts about your history that I know you've been jumping around to find answers for. And I'm not going to give you an answer to those right now, because I want to check in with a few colleagues and a few resources. What I can tell you is these several elements are something we can help you on, and I'm going to be in touch with you either prior to your first treatment or at your first treatment to bring you some information about these other areas we looked at. And that gives me the time I need to process, to look at PubMed, to call a colleague, and kind of dig into the resource and develop what my case perspective is and what my trial of care is going to be. But I think don't be afraid to still run your normal examination. Find those things that are low-hanging fruit that you can take some action on.
Awesome. Thank you.
Yeah. Cool. So let's, this is great. We should have been doing this all along. Great information. I want to ask this next one. What case or experience was your biggest challenge during this preceptorship?
I think for me, as not exciting as it sounds, right hip pain patient that came in experiencing pinching in the hip. We did a lot of mulligan traction, TSI, or targeted structure intervention soft tissue that we do in here in office. We did a lot of loading, and it seemed to me that it was somewhat beneficial, but nothing was necessarily helping. He took a week off for Thanksgiving break, and he said he felt 100% better. So it's kind of an understanding for the biopsychosocial aspect of pain and how this individual, if we kept focusing on his hip pain, it seemed to maybe not be as beneficial as we thought it would be, despite all the physical intervention. But when we kind of stepped away from the pain and I started to ask questions about his goals, which were one of them was driving for long periods of time, and some of the other goals that he had in mind were like weightlifting and squatting, it seemed to kind of shift his attention away from the pain and be in a more objective goal-setting aspect, and he was able to kind of recover from there.
Oh, that's awesome. Good experience.
Yeah.
Cool.
I would say right now, one that we're kind of all co-managing that I've been having my brain on for the last little bit is a plantar fasciitis case. I don't know if it's necessarily plantar fasciitis, but there's left heel pain involved. And I feel like it was always something that was secondary for this particular patient. But this is something that's been bothering them for a little bit, and we've been doing some different things and trying to kind of attack that and just not seeing any real change. And I feel like the more times they come in, the more I'm like, I don't know what to say other than like, give it more time, you know? So I feel like that's been challenging for me to be like, I think we're doing everything right here. We know where your limits are. Just give it more time and it'll eventually turn the corner. But it's hard because I don't know when it's going to turn the corner. So that's been tough for me. So.
Yeah, I think that's a big lesson, and it's hard to get used to. I think it can be hard to get used to in our practice Because when you're going through school, especially, you see a lot of cases that are rapid responders. It's other students, it's people that already know and love chiropractic that you're working with. And then what I for some reason chose to focus our practice onto all the people that don't respond to many interventions. So our average patient here has had something going on for 6 months or more and have tried one or two things and it hasn't worked for them. And then we come in and we try to be a little more thorough and bring some new options and solve that. But part of that is allowing the body to heal. Part of it is addressing the psychosocial part of things. And part of it is, getting them to shift their goals a little bit on actionable items rather than just that sensation of pain. And it can be frustrating to work with a patient through their own frustrations of, I started last week, this week is one step worse, but we're on the journey of getting 100% better. And it's certainly a frustrating thing. And I feel like it's a strength that you've been exposed to that and you've had to work through some of those cases as well. Yeah, cool. For other students, why do you think other students should consider this rotation or this preceptorship?
I'll start. I just think simplification. I feel like we get fed a lot of information in chiropractic school, and I feel like once you learn the language, like JP said, everything here just runs so smoothly, and it's complex, but it's simplified after you get through the initial stage, and that makes a lot of questions that you have easily answered, and the ones that you don't have the answers to, then you have these two docs to kind of run things off of. But I feel like for me, it's really simplified my view on chiropractic and clinical care as a whole. So,
Great.
I'd have to second that in a way. I feel like in chiropractic school, like Zach said, we got fed a lot of information. We were really good at diagnosing, but they didn't really teach us what to do after we got the diagnosis. A lot of education at school was just adjust the area. If it feels restricted, then send them on their way. But I feel like here, like Zach said, it's kind of simplified that if a patient is struggling with this, then you would do this intervention, which includes X, Y, and Z. So I feel like it's just a great opportunity to not only be a great diagnostic doc, but also a treatment doc and be able to know how to handle certain cases and be able to confidently tell the patient that we're able to help them with XYZ modality or treatment.
Great. So Zach, you were here for one trimester. What was that journey like from week one, and kind of like how was the build from week one to this final week structured for you?
yeah, it was good. There was a lot of learning early on. I feel like there was a point where I finally got over the hump, and after that, it was a lot easier. I loved every second here. I feel like looking back, I would have loved to have that second trimester like JP, but from week one all the way to right now, like I feel like it was all learning. I learned different things, obviously, and I felt like I got stronger throughout, but I feel like it was structured really, really well, and there was always good learning opportunities between you two and then JP as well, so.
Cool, great. So JP, you were here for 2 semesters, so you've been here for almost a year, which is exciting. How are things structured for you from like the start of first trimester through now the end of the second trimester you've been with
So
us?
starting the first trimester, thankfully, I had a couple grip seminars underneath the belt, so I kind of understood the language, but I wasn't 100%. Like Zach said, once you get over the hump, it's a little bit smooth sailing. The first trimester preceptor was a lot of hands-on. However, I wasn't managing any cases on my own, maybe a handful. Jumping into the second trimester preceptor, I'm seeing a lot of more patients on my own and managing their own care, running my own treatment plans for the patients, communicating with other healthcare providers to co-manage patient conditions. So it's more, I'm filling more of the doctor role rather than the student role towards that second trimester preceptor.
Cool. Yeah, so that's a good way to highlight what we're trying to do here. Obviously, once you've made it to the clinic phase of your education, you should be ready to run with patients. That's not to say you're ready to do it at an extremely high level when you first start, but we want to pick up our students where they're at and as rapidly as possible progress them through that whole process of learning specific roles and then running the show, being able to work with assistants, for example, at the very end. And you two are great examples when you really dig into the operations of how we work on cases. Those are going to be a lot of opportunities. And if things are going a little slower for you, we're probably not going to push you as far in like the lead case management that these two got an opportunity to do. So it's really, I don't want to say it's to choose your own adventure because there is a pathway here, but we're going to try to match the preceptorship opportunity and phase to where you're at so that it's a good experience for you. And that leads me to my next question. What are some things that you wish you would have been able to do in preparation for your preceptorship that you didn't get a chance to do? Or if there aren't any of those, what did you do to prepare that worked well for you?
For me, what I did, but I wish I did more of, is the grip seminars and grip courses. And then during my own time studying the FROMs, Global Research Strategies, and TSIs, I feel like it's hard for me individually to just sit down and look at them. Since I am a hands-on learner, I would have to have somebody to practice with. But it's kind of hard to practice with somebody because you have to take time out of your schedule and their schedule to get a little bit of hands-on training, so it's a little bit more difficult. So I just wish I spent more time diving deeper into the books with the GRSs and FROMs. But like I said, with the hands-on experience here at Cornerstone, I was able to pick it up relatively quick.
Awesome.
My answer yet again is very similar. I didn't have a whole lot of experience with grip before coming in. I did take that one course. Wish I took more, obviously. I was able to, before the preceptorship, watch kind of all of the videos of all the courses beforehand. I think I also studied a lot more anatomy before coming in as my first month kind of went through. I was continually going back to the anatomy and just kind of like brushing up on some of the things that we glossed over in school. I think that, just being able to go to more grip courses, being able to practice it more, like JP said, would have been beneficial in the long run. But I feel like it worked out pretty well. So
Cool. Great. Any closing questions, thoughts, or statements for you two?
I have a fun question.
Okay.
Do you guys remember your first patient as a doctor?
Yes.
Good question.
I do. I specifically remember it because I had just opened my doors and my license hadn't come in yet. And I was playing with the booking option, and a patient booked before my license had come in. And I had to hire a fellow student that I graduated with whose license did come in. I hired him to come sit in the office and be the license so we could start to onboard this new patient. So I remember her well. She was a cook at one of the hotels here in town. Yeah.
That's awesome. That's a good story.
Yeah. How about you, Jay? You remember your first patient?
Yes, it was my wife.
Oh,
There you go.
that is some good family support. Cool.
I still remember her.
That's good. Very healthy. Good. JP, any questions?
Nope, not for me.
And Jay, anything you want to use as a closing question or comment?
It's just great having you guys here, man. Thanks a lot.
Thank you.
Yeah. Cool. Well, if this sounds like an experience that would be right for you, reach out to either of these two preceptors or Dr. J or myself about joining us for that opportunity in the upcoming semesters. Thanks.